Today we are considering the importance of medical compatibility in marriage. The importance of medical compatibility in marriage. Medical compatibility in marriage simply refers to the compatibility of two individuals as husband and wife, the compatibility of their health, genetic makeup, and medical histories. It is essential to consider medical compatibility before marriage to ensure a healthy and a happy relationship. The compatibility of both of them medically will go a long way to determine so many things about their relationship and the success of their marriage health-wise. Now let's consider the reasons why medical compatibility is so important. One, it's so important because of genetic disorder. It helps us to discover genetic disorder and to know how to go about it. Certain genetic disorders such as sickle cell anemia or cystic fibrosis can be passed down to offspring if both parents are carriers. So if both parents are carriers of these ailments, sickle cell anemia or cystic fibrosis, it is easy for them to pass it down to the oncoming generation, that is their offspring, conveniently, if both parents are carriers. Number two, inherited health condition. Some health conditions, such as heart disease or diabetes, can be inherited from parents. So if one of the parents is a carrier or a victim of these terrible ailments, heart disease or diabetes, it is easy for them to pass it down to the upcoming generation. So their children can easily inherit these terrible ailments. Heart disease and diabetes can easily be transferred from parent to their children. Number three, blood type compatibility. Incompatible blood types can lead to complications during pregnancy or blood transfusion. So if their blood type is not compatible, this can lead to terrible complications during pregnancy and blood transfusion. So that is why it's so important for them to check and to know their medical compatibility before going to marriage. Number four, organic transplantation. Organic transplantation. Incompatible tissue types can make organ transplantation challenging or impossible. Incompatible tissue types can make organ transplantation challenging or impossible. So if the tissues are not compatible, it can make organ transplantation very, very risky and impossible. Number five is medical health. Mental health. Mental health conditions such as depression or anxiety can be inherited or triggered by genetic factors. Mental health conditions such as depression and anxiety can be inherited or transferred from parents to their offsprings and can also be triggered by genetic factors. So that is why it is most important for couples to know their medical status and to know if they are compatible before going further to marriage. Now let's look at the effects of medical incompatibility in marriage. Effects of medical incompatibility in marriage. Medical incompatibility can have significant effects on a marriage, including medical incompatibility can have adverse effects on marriage, and we shall look at some of those ways and how it goes now. The first type we're going to look at is the emotional and psychological effects. It can inflict an emotional and psychological effect on that marriage. One is stress and anxiety. Stress and anxiety. Medical incompatibility can cause significant stress and anxiety for both partners. That is, they will be disturbed physically and psychologically, and they'll be stressed all over them, and they'll be anxious of what they're passing through and probably what the outcome or the result may likely be. Number two, guilt and shame. partner may feel guilty or ashamed about their genetic makeup or medical history. So at the end of the day, they may discover that they are not compatible, and this can bring shame or guilt to both of them, since they have just discovered that they are not genetically compatible. So if they discover it, it may bring shame to them and guilt that they have not done the right thing by checking or taking time to discover if they are compatible or not. Number 3 is fear and uncertainty. Fear and uncertainty. Medical incompatibility can create fear and uncertainty about the future, particularly regarding children. So when they are not compatible, it can trigger fear in their hearts, and of course distress and stress and worries will crop up, and because of that, they will be so disturbed because they don't know how the future is going to look like, particularly regarding how, if they will be able to bear children or not. The second aspect is the physical effects. The physical effects. 1. Complication during pregnancy. Medical incompatibility can lead to complications during pregnancy, such as miscarriage or birth defects. So when the couples are not compatible, it can trigger several kind of terrible things or situations. More especially during pregnancy, it can lead to miscarriage and can also cause birth defects, which can also be very adverse and very terrible. So it can lead to terrible situation on the part of the woman during pregnancy and at giving of birth. Number 2 is chronic health condition. Medical incompatibility can increase the risk of chronic health condition, such as heart disease and diabetes. So when couples are not medically compatible, it can also trigger or increase their tendency to terrible chronic health conditions, such as heart disease and diabetes. So all this can easily manifest in the life of the children or in the life of the offspring of this family. So they can develop terrible heart disease condition, chronic heart disease condition, and diabetes. Number 3, reduce quality of life. Medical incompatibility can reduce the quality of life for both partners, particularly if one has a chronic health condition. So it can actually lead to reduced lifespan of the partner, and not only of the partner, even of the offspring that inherited such from them. So it can lead to reduced lifespan of such individual. And of course, when this happens, the family may not be really happy about it. So let's look at examples of medical compatibility issues in marriage. Let's look at example of medical compatibility issues in marriage. Number 1 is sickle cell anemia. A couple where both partners are carriers of sickle cell genes may face a higher risk of having children with sickle cell anemia. So if both of them are carriers, the husband and the wife, they are carriers of this terrible ailment, there's 50% tendency, if not 100% tendency, for them to have children that will be also, that will suffer these ailments. There will be real sickle cell patients. And of course, taking care of, handling them and caring for them can be very, very costly. Number 2 is cystic fibrosis. Cystic fibrosis. A couple where both partners are carrier of the cystic fibrosis gene may face a higher risk of having children with cystic fibrosis. So when the both parents are carriers of these terrible ailments, cystic fibrosis, then they'll have children that will definitely suffer the risk of cystic fibrosis. Number 3 is blood type incompatibility. A couple with incompatible blood types, e.g., rhesus positive and rhesus negative, may face complications during pregnancy and blood transfusion. As we know that the positive will always affect the negative. So it's either both of them are of the same rhesus factor, it's the best arrangements. But if the wife is of positive rhesus factor and the husband is negative rhesus factor, there will always be problem on the side of the wife when she's pregnant. It can lead to miscarriage or complication in getting pregnant. So, but this can be solved medically. Number 4 is organ transplantation. A couple with incompatible tissue types may face challenges or impossibility in organ transplantation. So if they are not compatible, or if their tissues are not compatible, it may not likely accept the incompatible one if there is any kind of transplantation. So, and this can lead to a terrible situation in future. Now, how do we address medical compatibility issues in marriage? How do we address them? How do we solve it? How do we amend? 1. Genetic testing. Couples can undergo genetic testing to identify potential genetic disorder or health condition. So it's so important that couples should undergo genetic tests, carry out tests, go to the health center, to go and check your genotype, your blood group, your rhesus factor, and many other things that are so important as far as health is concerned, to see if both of you are compatible or not. And this is for your own good. There are times that when couples to be advised to go for such tests, they lobby their way and bring fake results. By the end of the day, when they get married, both of them will actually face the consequence if they have actually not done the right thing. So it's for their own personal good. Number 2, medical history. Couples should share their medical history, including any chronic health condition or genetic disorder. So they should feel free to discuss whatever may be the health or medical history with each other. If there's any chronic disease or anything that they are passing through, they should feel free to discuss with one another before going further into marriage. Number 3 is counseling. Couples can seek counsel to discuss medical complication or compatibility issues and develop strategy for managing them. And if actually there are any issue medically, they should seek for counseling to know how to manage these issues in marriage so that it will not affect them negatively. Then the last one is family planning. Couples can plan their family carefully, considering the risk and the consequence of medical incompatibility. So the family can be planned to know when a child is coming or when a child is not expected. So in a nutshell, we have looked at the importance of medical compatibility in marriage. The best is for both of them to be compatible medically, to have a happy home and a successful marriage. Because failure to be compatible can lead to a series of terrible things. And we've looked at the reason why there should be a medical compatibility. Why is so important to us as far as marriage is concerned? To discover the genetic disorder that may be present in any of the couple, to know if there's any inherited health condition such as diabetes or heart disease in any one of them, and to know if their blood type is compatible, and even if their organs are also compatible, and if there is no any mental health disorder like depression and anxiety. And we've also discussed that the effect of medical incompatibility, it can cause emotional, psychological effects such as stress and anxiety, where both of them will be disturbed, guilt and shame, fear and uncertainty. And physically, it can also cause complications during pregnancy, chronic health condition, and reduced quality of lifespan of either the parents or the couples or their offsprings. And we have looked at examples of medical compatibility issues such as sickle cell anemia, cystic fibrosis, blood type incompatibility, and organ transplantation. And we'll now discuss the way out, how to address medical incompatibility issues. We talk about genetic testing. That is very important for them to go for medical checkup to know if their genotype, their blood group, and every other thing are compatible. Then we should also talk about the fact that they should discuss their medical history with one another, and they should seek for counseling to know how to manage any ailments that may want to manifest in their marriage. And finally, we talk about family planning, that there should be family planning to determine when and how their children will come and how it's going to be. So these are some of the importance of medical compatibility in marriage. Thank you and have a wonderful day.